Good afternoon and evening, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, and I'll be your moderator. Tonight, we're joined by Joy Void-Holmes and Daniel Sarjeant. Together, they will review strategies for treatment room ergonomics. If there are any questions, please add them into the Q&A section, and we'll answer them at the end. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand, and this webinar is sponsored by A-dec. Joy, welcome and take it away.
Thank you for joining us. As was stated, we are here to talk about developments in ergonomics and magnification. I am joined by Daniel Sarjeant today with A-dec, and we are here to provide you a wealth of information on how to stay ergonomically healthy while in the operatory. Henry Schein cannot support or refute. And as with any presentation you listen to, you should apply your own professional judgment with respect to the information provided. I do not have a leadership or financial relationship to disclose in this presentation. However, I am being compensated by Henry Schein for my presentation tonight. About myself, I am a dental hygienist. I Southeastern University, my master's and doctorate in health sciences. I am founder of my own company, Dr. Joy RDH, and board for and on the editorial review board for Inside Dental Hygiene. Organizations. So why is it that we constantly talk about ergonomics? So I'm going to age myself a little bit here. I graduated in 1987, and I can certainly see that a lot of the tools that I use, a lot of the ergonomic principles I had been taught back during that time, all of those things have changed. We also know at the height of COVID, when we couldn't use our rotary instruments, we had to have a lot more PPE and pretty much had to use whatever we were given. A lot more attention was paid to ergonomics because we had to go back to traditional ways of practicing dentistry. What I have found throughout my journey as a dental hygienist and as an educator is that we have to be concerned with several things when we talk about ergonomics. I think one of the biggest misnomers is that ergonomics is simply concerned with how we sit in our chairs. And you're going to find out throughout this presentation, ergonomics is concerned with so many things: your instruments, your operatory, your shelving, everything. So I hope that at the end of this presentation, you will make an assessment of how ergonomically healthy you are and how ergonomically sound your operatory is. And if you find that some adjustments need to be made, hopefully you will have some some tips and tricks that will allow you to become more other items that will help promote that professional health for you. These are the objectives that we are going to cover this evening. So we're going to identify some signs and symptoms of common musculoskeletal disorders, and you should be able to assess your own personal situation. You'll be able to implement preventive measures that all staff can take to protect themselves from those musculoskeletal disorders. You are going to learn how to design an ergonomic treatment room, which involves the seating, the storage, the shelving, and different types of delivery systems. And then last, you're going to be able to explain the different innovations in delivery systems that help to support that ergonomic health while highlighting what we call the Continental design. So ergonomics, we know, can make or break your career. I find myself when I travel or when I'm doing different exams for students, I find myself looking at how people are sitting in their chairs. And, do you remember how to sit, or do all of those principles go out the window once you graduate? I also feel like we don't teach enough of standing positions. So this is for dental hygienists and dentists alike. So what are some of the factors that actually contribute to poor ergonomic health? Before we get into that, I think it's important that we define what ergonomics is. There are several definitions here on the screen. I'm going to read a few of them. Ergonomics is an applied science. So science, we study a lot of it. It is applied science concerned with the fit between people, their technological tools, and their environment. And the definition that I have highlighted at the bottom: The equipment should be designed to fit the user instead of the user fitting the equipment. Far too often in dentistry, the user is forced to fit the equipment that is given to them, and that really leads to a lot of poor ergonomic health. When we are faced with poor ergonomics over time, what we do is that we expose ourselves to developing what we call musculoskeletal disorders or repetitive strain injuries. And these are all types of injuries that affect the musculoskeletal system and typically caused by overuse of certain body parts or different repetitive tasks. And if you think about what it is that you do on a daily basis, we're doing the same thing over and over and over again, especially in the dental hygiene treatment room. So what are the statistics telling us? I know you hear people talk about, their bodies are hurting sometimes at the end of the day, or you may have even known someone or even yourself. You may have had to retire because you've suffered injury to a body part. But what did the statistics say? So this is a study here. It was conducted in 2020, so relatively recently. And the title of this study was Occupation-Related Musculoskeletal Disorders Among Dental Professionals. This study actually studied many different health practitioners. And what we found, it studied general surgeons, physicians, but what we found is that dentists ranked the highest with suffering from musculoskeletal pain. This next study here actually provided a questionnaire, and what they wanted to study was what factors determine early retirement. Okay, so they referred to this as ill health. Okay, and it was quite shocking. So I am going to read the slide here, just because I want to reiterate a few points. So the purpose of the study was to determine the factors that contributed to premature retirement for general dental practitioners' ill health. Okay, so there was approximately 180 questionnaires that was returned. The mean age of the respondent population was 51.5. So that's not that old. That's still pretty young. Okay. The range of the respondents, age range of the respondents was anywhere between 31 and 62 years. And what they found was the most common cause of ill health retirement was musculoskeletal disorders, ranking at 55%. The majority were able to work up to their retirement, and a similar number would have liked to continue working. So 55%, guys, that's pretty major, meaning that you've had to retire before you were ready. So there are so many things that contribute to musculoskeletal disorders, and we'll get into those. But just think there different tools, equipment, office designs that could actually help promote career longevity. So I really found that to be a really interesting statistic. So when we talk about musculoskeletal disorders, there are a few things that we actually need to consider. So you should ask yourself during your assessment of yourself the following questions. The frequency. How often are you engaged in the activities that possibly put you at risk? So how many times a week are you doing these things? How many times a day are you doing these things? How long are you engaged in each of these activities? So have you been practicing 20 years? How many times a month? How many times a week? Hours and minutes? Okay. And then last, how intense are these activities? Are you doing complex or simple procedures? Meaning from a dental hygiene standpoint, are you doing really intense root debridement procedures, or are you doing simple perio maintenance procedures? So those are all things that you need to consider. As I stated previously, there are a number of things that contribute to musculoskeletal disorders and repetitive strain injuries. So your awkward postures, static work positions, force. So when I talk about force, I'm really referring to how you're holding your instruments, how tight you may be holding your instruments, okay? The repetitive movements, confined workspaces, and again, equipment, office design. Now, unfortunately, if you're not a practice owner and you don't have the advantage of walking into a space and creating what you want, you are kind of stuck with what you have. But if you're one of those lucky people who are ever asked, hey, we're building a new office, I'd love your input, hopefully you can take some of the lessons that you've learned here. But outside of work, Do we have habits in our personal lives that are contributing to poor ergonomic health? And the answer is absolutely yes. I want you to take a look at this picture and tell me if any of this looks familiar. Okay, so technology. Technology. I think our bodies have a love-hate relationship with it. Technology actually has an ugly side to it in that it is definitely contributing to poor ergonomic health. I think the majority of us on this call have a phone, but we certainly all have a laptop or a computer. Otherwise, you wouldn't be able to view this presentation. Okay, so in addition to our day-to-day clinical activities, we're finding ourselves in front of our phones, in front of a computer, not only at work, but at home as well. And the use of these devices, according to several research articles, once again, are contributing to poor ergonomic health. Okay, so just take a look at it. Most times I'm going to grab my phone here. When you're walking down the street and you're on your phone, chances are your head is down like this, right? I know for me right now, when I give certain webinars, I try to angle my camera so that I can see you, but also so that my head is straight and it still isn't as straight as it needs to be. If you think about if you're in your office and you're on a computer, chances are you're down and you're most likely typing. And think about your kids, right? If they have a tablet, okay, what's happening? Their head is down. And so this is contributing to something that is described as forward head posture, okay? So forward head posture, and I'm just going to read the slide, is associated with the head moving in an anterior relationship to the shoulder or lower spine versus an ideal position. And that ideal position would have the ears in line with the shoulders, okay? So when a patient or a person rather maintains good posture, their head aligns vertically with the spine. With forward head posture, the person is leaning their head forward. Once again, it is out of neutral alignment with the spine, okay? And when the alignment of the head is off, it can certainly cause a variety of problems. I absolutely love this slide here. There was a study conducted in 2014, and it assessed the stresses in spine by posture and position of the head, okay? So forward head posture puts strain on the muscles and bones of the neck. It can contribute to muscle imbalances and actually imbalances to muscles that support the load of other muscles. What this picture here is demonstrating is for the different degrees that you lean your head forward, okay? So in neutral position, your head sitting on top of your spine weighs about 10 to 12 pounds. You lean your head forward 15 degrees, that increases to 27 pounds. You lean your head 30 degrees, that then increases to 40 pounds, and so forth and so on. So imagine if you are consistently leaning your head down, okay, as far as you can, thinking chin to chest, you've put about 60 pounds of added pressure on top of your spine. Physically, it causes changes in your appearance. And what you see here is that the shoulders then become rounded and the back becomes rounded. This was shocking to me. I actually went into the mirror and looked at myself, and I actually have this type of appearance. In addition to the physical changes, there's anterior neck pain. You get those myofascial trigger points. You get headaches. You have TMJ disorders, again, balance issues, and then respiratory problems. We know that we're studying a lot about airway now, and so forward head posture could be contributing to that. So there are a variety of solutions that can help with that. Here, it's just a lot of words. I know there were videos attached to this, but I want to be mindful of time and make sure that we get all of this information to you. So there are some hand and wrist exercises that you can certainly do while you are sitting in the operatory. If you're waiting for patients, if you're waiting for a check, if you're a dental hygienist, if you're waiting for the assistant to do something for you, if you're a dentist, there are different types of hand stretches you can do. There are 3 listed here. These are also 2 others. This is the beautiful thing about Google, you can almost Google anything and see these different exercises for you to do. They take no more than 5 to 10 seconds. And again, the more often you do them, the better off you are throughout the day. In addition, when you're using your cell phone, instead of having your head down, I'm going to grab my cell phone again. You actually want to look at your cell phone like this. So people may think that you look a little strange walking around, but you actually should raise the level of whatever electronic device that you're using, including your tablets, including your laptops. You want to make sure that things are in line so that your head can be as neutral as possible. Another thing for clinicians, you want to be mindful of your operator positioning. So the balance is going to be key here. We have to learn to balance our body so that we are in complete control, so that we can successfully perform the task at hand. We also to be of healthy position. So here, I'm not going to read everything to you, but you can see what the ideal seating position is. One thing you should be mindful of is that your thighs actually should be lower than your hips. And this is definitely something that is a lot different from what I was taught. You also want to be very agile, okay? You want to keep moving, changing your body weight, maintain an athletic balance. So for those of you who are into sports, especially if it's a sport that involves your feet, they're all about balance, right? Making sure that you take moments to pause. That's going to be very important as well. For those of you who see children, okay, you want to make sure that the child's head is all the way at the top of the seat. Typically what happens is that a child doesn't have their head all the way at the top of the chair, and so it causes us to bend. You definitely want to consider motorized head positioning. So this is really important. When we are working in the mandibular and maxillary arches, the head position of our patient should be different, and that motorized headrest actually helps to facilitate that. This slide really talks about the importance of an ergonomic headrest. When we do not have an ergonomic headrest, what happens is that the patient's head can't be supported in the desired area. And what do? It's almost like second nature. We bend or we twist our spines to compensate for that. We often talk about neutrality. We don't need to be robots, but you can go 20 degrees outside of what neutral positioning is. So you can bend your wrist a little, you can bend your head a little, but you never want to go more than 20 degrees outside of that. And so with that, you have to be mindful of your clock positions, how you're sitting around the patient, how the patient is turning their head toward you. And then as far as your seating, okay, I would certainly recommend that you evaluate the type of seat that you're sitting in. Whatever operator chair that you use, you want to make sure that it is flexible, it's comfortable. Most importantly, make sure that it has a sturdy base, that it is designed to fit the clinician, okay, and that it has an ergonomic design. Saddle seating is an option. I know some people say they absolutely hate it, but what I find with your saddle seats, they're actually designed for the person. So it's not like a regular chair. It's not a one size fit all deal. And what I find with the saddle seats is that most people have a preferred pan style. So the actual area where you're sitting, some are more concave, some are more convex. Okay, so you want to make sure that you're getting something that you're comfortable with. You also want to make sure that you consider the tilt, okay, that dictates how far you lean forward or lean back, and then also consider the ceiling height, the cylinder height. I've taught people as an educator that were 6'2", and of course, a person who's 6'2" can't sit in the same chair as a person who's vertically challenged like me. I'm 5'2". So those are all things to consider. Outside of those things, your actual office design is something that you need to consider. Okay, and so at this point, I am going to turn it over to Daniel, and he's going to talk about additional pathways for you to stay ergonomically healthy.
Good evening, everybody, or at least my folks on the East Coast, good evening. As we move west, good afternoon. Certainly want to thank Dr. Joy Void-Holmes for being my partner in this presentation. We've gotten to know each other well, though we've never met in person. And want to thank Henry Schein for having us. My name is Daniel Sarjeant. I work for A-dec Dental Equipment, and I am in Charlotte, North Carolina. A-dec is sponsoring this particular webinar, and we do a lot of interactive content. We do a lot of content with Henry Schein, and we're thrilled to be a part of this presentation. We're going to delve into some more about ergonomics and talk a little bit about who we are and where we fit into the picture. So like I said, I'm in Charlotte, North Carolina. A-dec as a company is located in Newberg, Oregon. That's a picture of our facility right there that you can see. That we photoshopped some sun in there for anybody who's ever been to Oregon. It doesn't always look like that, but we are a family-owned company. A-dec is an acronym, stands for Austin Dental Equipment Company, founded by Ken and Joanne Austin. The Austin family still owns and runs A-dec, so I work for them in Charlotte, North Carolina, and I cover most of the North Carolina area. So if any of my North Carolina folks are on, hello, good evening. What do? We make dental equipment. It is the only thing that we do. I think if you have been in a dental office, you probably have seen some A-dec, worked with some A-dec. We are in all but a couple of dental schools and have a large presence within the industry, and dental equipment is all that we do. About 8 years ago, A-dec got the entire group of territory managers, which is me, and about 68 counterparts across the country, and spent some money for us to spend a week in Atlanta and get a certification as a CEAS, which is a Certified Ergonomic Assessment Specialist. And I didn't know that that was a thing, but apparently I can go into a workspace and talk to people about how they're sitting at work or standing at work. And as we know, Dr. Joy said, that's really what ergonomics is. It's how we position ourselves at whatever we are doing for our jobs. And I think in theory, I can walk into any office building and start talking. I've really limited it to dental offices at this point, but you never know. But what I do is work with all of my local folks here, my Henry Schein folks and my local doctors, and talk to them about how their office environment impacts their ergonomics. And one of the big things that we talk about is room layout, because Dr. Joy did a great job in talking about all of these musculoskeletal disorders and how we position ourselves in ways that get us hurt. We position our equipment in ways that get us hurt. And I talk all the time about exactly what she said. And that's really to manipulate your dental equipment around yourself. Don't manipulate your equipment around the procedure. But a lot of times that room layout may prevent it. So one of the things that I spend a lot of time with my Henry Schein folks talking about is office design. And this is where you work. This is the environment where the ergonomics takes place for you. And if you don't have the space that you need, or the storage that you need, or the ability to position yourself around that oral cavity, then the equipment may not necessarily matter, or at the very least, we may need to make some adjustments to something in that treatment room. And I chose this plan because it was one that I knew, and it's got a variety of things going on. But what I really like is we've got some walls and some more private operatories down here at the bottom. We've got a central divider, which is a cabinet that can separate an operatory up here. Sometimes when we're a little more space limited, that might be something that can really open up that treatment space, because it's all about you having access as the operator to the oral cavity to work in that good ergonomic power zone. And we all know where it is. We all know exactly, as Dr. Joyce said, if I send a text, I really want to try to be right here, ideally maybe even right here. But that ergonomic power zone, we know when we are there and we know when we're outside of it. So how can I really maximize that space? I found this dental plan online. This is an actual dental office that somebody designed. I don't know who it was, but I picked it because I think I actually Googled, Dr. Joy, to your point, I Googled very tight dental space. And this is what came up. And if I'm looking at those two images and looking at the position that those practitioners and operators might be in relative to the equipment in that room, I think this one gives me a little bit of claustrophobia. The other one has some ample space. Now, at some juncture, you may be designing a dental practice. And when you do so, there are people like Henry Schein designers, equipment specialists, architects that will help you through that process. Whatever space you're working in now, you may not have control over it. But what I like to talk about is, hey, what does that perfect scenario look like? What does your treatment room look like if you do have the ability to create that ideal working space? And just to talk to you a little bit briefly about where dental equipment has come from and where we are going, we want to try to create a space that you can sit around that dental chair and around that oral cavity in whatever fashion you see fit. I've seen a lot of people tout that you should be at 12 o'clock, that you should be sitting at true 12 with the patient right here and straddling the patient's headrest. And that gives you great ability to use indirect lighting for almost any work surface. Maybe direct lighting on some anteriors or buccal facing teeth. But not everybody can sit there. In that other dental office we showed, I don't think you could position yourself there. So what can we do as a dental equipment manufacturer at A-dec to make that access better? We can create a thinner chair. We can allow you to straddle it at 12 o'clock if that's the way that you prefer to sit. But if you've got to come around and sit more at 9 o'clock, you can get it underneath that dental chair and bring that oral cavity closer to you into that ergonomic power zone. And if you're a hygienist, well, then you might be everywhere from 3 o'clock all the way over to 9 o'clock. And being able to get underneath that dental chair is something that we've worked very hard to change within the industry, because older dental chairs looked like lazy boys. They were about that thick. They had big metal backs and a whole lot of padding to keep somebody from hitting the backrest. Well, now we've got a little more sleek, thin, flexible backrests. It's something that we're really focused on and something that we want to try to create for our practitioners, because everybody sits a little bit differently. Every procedure is different. So that's where we're headed, just as a brief snapshot of what we're doing ergonomically. But the thing that I spend the most time on, people always say, what do you do for your job? I think most of my friends just think I sell drills. They think Daniel sells dental equipment, he sells drills. Not entirely accurate, but I do ask, where do you want to take your handpieces from? It's one of the most important questions that someone like me, who tries to consult with my local dentist and local hygienist, where do you want to take your handpieces from? Do you want them in front of you? Do you want to turn around and get them from behind you? There's a lot of different ways we could design a treatment room space, and I need to know how you prefer to work, and we need to talk about those ergonomics. So here is a visual, an actual picture that pretty much represents Dr. Joy's slide from about 10 slides ago. And her slide was about articulating headrests. Now, this happens to be an A-dec chair, so I know that this has a double articulating headrest. And just looking at this picture, of which I know nothing about, I don't know this doctor, I don't know the patient, but I do think that I could come in and say, hey, doc, I'm not necessarily sure you need to be in that position for very long. And there's some things that we may be able to do, whether it's recline the chair, articulate the headrest. So this is what I spend most of my time doing. This is how I really feel that A-dec and its representatives can contribute to the industry and contribute to our local practitioners. Here's a scenario where we've captured someone who is doing a full turn to get something from behind. And anybody who's worked chairside, and I volunteer at the mom clinic as an assistant. I've never been a dentist. I've never been a hygienist. I've been chairside. I don't really know what's happening. I'm not the best assistant of all time. But I do know that me turning around and grabbing things from behind me is not as easy as me grabbing something that's right here. And one of the reasons I show this slide is because you can really see that this person is making an effort to get something from behind them, making an effort to see. The assistant is having a hard time seeing. So if somebody tells me that they're very interested in looking at rear delivery, I always say, okay, well, let's talk about that. If you've never used rear delivery, that's something where you're going to be turning, you're going to be grabbing with your non-dominant hand, you're going to be passing to your dominant hand. There's a lot going on there. And maybe you're used to it and you like it, but it's a conversation that's certainly worth having in regard to the ergonomics of that treatment space. Now, this is a slide from A-dec that says Continental Delivery. I took it from another presentation and I took it on purpose. This was actually showing the light and how we position the dental light for perfect stadium lighting. I do like this young lady's posture. I happen to know her. She's not a dentist. She works in marketing at A-dec. The reason that I'm showing this slide is because something that I talk about a lot when it comes to delivery systems is Continental Delivery, which, if anybody doesn't know what that is an over-the-patient delivery, just like you see there, but instead of hanging tubings, which we would call traditional, the tubings are routed over top. And a lot of people have seen this. A lot of people I've been with have seen this and said, I don't like that. It's not for me. And I'll say, oh, have you used it? No, but it's not for me. And I'll say, okay, this is my favorite conversation to have, to say, all right, why is it not for you? And I think it's basically because of this picture. Or or a picture like this. The concept or the misconception maybe that this is where a continental delivery system would be placed relative to the patient. And they say, I think it would be threatening. I totally agree if that's where I would place it on a regular basis. So I think if you look at some other pictures of continental, which I think has huge ergonomic benefit to keeping the patient or the practitioner in a good upright posture, keeping that head very static. You can grab a continental whip arm without even looking at it. It becomes much like a rheostat or a foot control to where you know where it is. You can find it without really looking at it. You can grab that whip arm and really never change that perfect posture. You've got your focal depth set, you've got your lighting set, your eyes are accustomed to that oral cavity, and you really can move that delivery system without thinking a whole lot about it. And I love that about it. You can alleviate some wrist and arm fatigue. You can't drop a handpiece. I know no dental office has ever dropped a handpiece on the floor, but allegedly, if one has ever hit the floor, it typically damages them. So I am going to close by showing you a video because you don't have to take it from me. One of my best friends here in Charlotte, he and I did a continental training video, and I really wanted him to showcase how ergonomically it has worked for him because I've seen it make a huge impact on his practice and the way he practices. So what I want to do is show this video really quickly, and you'll be able to hear a little bit. It's only about 2 minutes long, but you'll be able to hear some of his commentary on his continental.
All right. Starting position, I would say is like to the right of my knee here, above knee level.
And not in conflict with the patient. I can tell it's definitely not in conflict even with their arm. So that's probably where you would start most often. Show us the reach of the whip arm from that position to the oral cavity. All right. And you would typically have your loops on, but
sure.
Even though you weren't really cutting right there, your posture was pretty good. Now I'm going to call out a couple of different tooth surfaces and maybe show me. And I know you said that you almost don't even think about it, right?
Definitely don't think about it.
Okay, so it's sort of become second nature for you. You've worked with this for.
Yes.
I'm sorry, I made you think about it. But what I'll do is try to call out a couple tooth surfaces. You maybe position the patient's head a little bit. Position yourself.
Yeah.
Position your light if you need to. But show me where you like to put the continental. Most importantly, right. And I'll walk you through a little bit about what I'm telling him right now. I asked him to cut on the buccal surface of 15, positioning the patient using direct vision. And I wanted to see where he put that continental delivery system and how he got that perfect burr angle and got that whip arm to come forward and really take the weight out of the handpiece, allow him to directly look at that tooth surface, work in a heart-healthy position, not bend too far over. He was talking about not hitting his head on the whip arm, so he lowered it down a little bit. But this is something that he and I worked on, and we created this video to really showcase how I feel like the misconception of that continental delivery system being truly over the patient, truly transthorax, is not the reality of the folks that have gotten pretty adept at using it. Just watching him move that delivery system, change to the lingual surface of the same tooth, still using direct vision and being in a really a pretty good posture right there. So I'm going to stop sharing my video now and give this back to Joy. And she is going to bring it on home for us. But that is a little bit about who I am, what I do, and what A-dec does on a regular basis. And really appreciate your time. So Dr. Joy, I'm going to leave it with you.
Thank you, Daniel. Before I continue, the one thing that I definitely wanted you to highlight for the audience, and I know when you and I initially spoke, what I didn't like about the traditional continental systems is not being able to get my handpiece in the place that I needed. There were some restrictions. Can you speak to the audience about the newer designs and how that's not necessarily a factor anymore?
Absolutely. A-dec called the delivery system, and we were the first domestic manufacturer to make the Continental here. We had to go over to Cologne to the IDS meeting to see it, and that's why we called it the Continental. We had to leave the continent to go see how other people practiced. And our original designs, I think, though conceptually were correct, I think they lacked a few things. One of them was the reach of the whip arms. We now have a much longer whip arm, and we have a whip arm that has a break point in the middle, or you have a different one where the delivery system pivots at the front as opposed to way back in the back. So the maneuverability of that handpiece or that whip arm is much different now. So as you're trying to get to that perfect burr surface or burr angle for that tooth surface, you really can get a great angle directly to that spot. And whether you're using indirect or direct vision, you can get it in a great position with maybe a little head turn of the patient or a move of the unit. And in the same vein, somebody asked a question, is Continental suited for electric handpieces? I believe that it is the most suited towards electrics because of the weight. Now, they're not as heavy as they used to be, but electric motors and handpieces still have more weight than a traditional air-driven. And when you take that tubing drag out of it and really put the weight just in the handpiece, it becomes a lot easier to manage and move that electric handpiece system to the oral cavity.
Thank you, Daniel. I thought that was really, really important. So this is a great segue into talking about handle recommendations. So in addition to, different things that we've already discussed, when you talk about hand pieces, you need to be mindful of the hand pieces that you're using and the hand instruments that you're using. In dentistry, we are consistently working with things in our hand, and there are a few ergonomic design features that you need to be concerned with, especially for periodontal instruments. So there are ergonomic benefits to certain handles out there on the market. I will tell you, when I graduated, most of the dental instruments, especially the majority of the periodontal instruments, they were really, really heavy and they were really, really thin. And that actually exposed a lot of dental hygiene professionals and those dentists and periodontists who did a lot of perio type procedures. It really exposed them to those musculoskeletal disorders. So in terms of the things or the periodontal instruments you hold in your hand, you definitely want to use an instrument that has a large diameter. So something that is really, really wide, okay? You also want to use a handle that's lighter. And that's really, really important. What that does is that it helps to reduce what we call pinch force. So pinch force is actually how tight you're holding your instrument. So your typical modified pen grasp, right? You use your index finger and your thumb to hold on to the instrument. And so how tight you're holding the instrument. So if you have a wide instrument, and it's not as heavy, you don't have to squeeze as hard. You also want to consider an instrument that has tapering near the shank of the instrument. So the shank is the area of the instrument between the working end and the handle. That also helps to reduce pinch force, and it helps to keep your fingers coupled when you're working in a wet environment. And we know, unless your patient has an extreme case of dry mouth, the mouth is a wet environment. Next, you want to consider an instrument that has some sort of texturing or knurling on the instrument. So you feel something when you're holding the instrument. Once again, that's really, really important because it helps to reduce pinch force. Right here, I'm not sure how well you can see, I have several different instruments here. I have stainless steel handles. I have handles with a silicone grip. I have resin-based handles with a different type of polymer on them. But the one thing you can notice is that they all have some sort of texturing and knurling on them. That's really, really important. I love instruments, so I kind of collect those like people collect other things. So please don't judge me here. What does the evidence tell us? So in terms of an instrument, you definitely want a handle that's wider than 10 millimeters. And then in terms of how heavy your instrument is, you definitely want something that's lighter than 15 grams, okay? That actually helps to support muscle activity. Once again, we were talking about pinch force or pressure. Okay, there are 3 different pressure forces at play when we are holding our instruments. Okay, that pinch pressure, how tight we're holding the instrument, lateral pressure. So that's the amount of pressure that's applied when the working end of the instrument is placed against the tooth. Or fulcrum pressure. So that's, it stabilizes our hand so that we don't come flying off the tooth. When you are working with an ergonomically designed handle, it reduces this pressure. Thereby, it decreases your chances for developing a musculoskeletal disorder. Of course, you have to be ergonomically healthy or sound in all other areas, but this is just one area. The last area that I really want to focus on is magnification. We've got to be able to see what we're doing, okay? And what happens when we can't see, just think if I were to take my glasses off, naturally, I'm not going to be able to see the small print. So I'm going to lean in. And that typically happens when we're treating our patients. And so this is why I definitely recommend all dental professionals consider some sort of magnification, okay? So what does magnification do? It amplifies or it enlarges and exaggerates an intensified view of an object or an image or a model, okay? In dentistry, we can achieve magnification through the use of a microscope or dental loops, okay? So there are a couple of things that you definitely need to be mindful of before purchasing a set of dental loops. The biggest thing that you need to be concerned with is the distance between the operator area that you are treating. Really good sales rep who knows what they're doing, they will explain all of these things to you. Sometimes I log on to social media and I see people put their loops up for sale. And I'm thinking there are so many different measurements that are involved with a pair of loops. It would be impossible for one person to be able to use someone else's loops. I almost say when you are fitted for a pair of loops, they're unique to you, almost like a fingerprint, right? No two are ever really going to be the same. Again, what is the science telling us about the benefits of magnification? We get that enhanced visual acuity, okay? Less reworks, better hand-eye coordination. But the biggest thing here is that there's an ergonomic. Remember, we talked about neutral body posture, where we really don't want our heads leaning forward because we're putting that unnecessary weight on our spine, okay? So we want to be able to work pain-free. We want to be able to promote career longevity. Loops, again, have been well supported in the literature. It definitely helps to decrease bending and slouching and preventive cumulative injury. Magnification is really not the focal point, but I will say with the different dental loops, what I find fascinating now, the actual telescopes on the loops, some companies have designed them where they are tilted or the declination is completely pointing downward so that instead of bending your head a little bit, you actually can sit straight up. So just imagine my hands. Imagine my hands were the mouth, okay? And depending on the loops that you're using, you actually can keep your head straight forward and actually see what it is that you're doing. So the advancements and innovation with the magnification and the loops, the lighting, it's absolutely phenomenal. So if you haven't been out, if you haven't been to a convention in a while, or you haven't been to a study club where you have been introduced to these new dental loops, I highly, highly encourage you to get out and visit. Absolutely phenomenal. So this is just a recap of everything that we've talked about. So once again, the biggest takeaway here is that ergonomics is not just about how you're sitting in your chair. You have to concern yourself with other things that impact that. But most importantly, I think people don't ever really consider the design of their treatment room. And that plays a major, major part in your overall ergonomic health. So I want to thank you for joining us. Thank you to Daniel for the wonderful information. I actually learned a lot throughout this process of working with him. And I think we have time for some Q&A.
Absolutely. Thank you so much. We've got 15 minutes. If anyone does have questions, drop them in the chat or Q&A. I believe, let's see, the first one here is for you, Joy. Can you repeat where you received your CEAS?
My CEAS, I believe that was Daniel.
Oh, sorry.
Yes.
So Monica asked that question, and that was a certification that I received physically in Atlanta, but the company that puts the program together and all of the content is a company called the Back School. And so we went through a week-long program where we learned a lot about musculoskeletal disorders, a lot about ergonomics, and ultimately got a certification from the Back School as a CEAS and ergonomic assessment specialist. So good question.
All right, next one here. If I'm understanding correctly, does A-dec have lightweight HVE tubing available in smooth outer surface?
Smooth outer surface. Okay, so this is a great question. You're going to get a little tiny bit of engineering here on HVE tubings. So traditional HVE tubings, which are made out of vinyl, that we make at A-dec, we extrude them there. The internal bore, so the inside, we use a hexagonal die, it's a hexagonal bore through there, and that prevents it from kinking. So even if you grabbed it and kinked it, there would still be some airflow so that you wouldn't get any backflow through your HVE. The exterior of that has a smooth outer surface. We created a new tubing called Easy Flex that's been out a couple of years. And instead of that hexagonal bore, it's got some lightweight spiral corrugated wire that runs through it. So it does have a corrugated outside, but it is a lot lighter weight. And even after wiping it repeatedly with a disinfectant, it still stays very, very pliable, very, very flexible. So it's easier on your hands, but it is still very aseptic. The corrugation is very, very light. It's not deep like a corrugated umbilical, like a vacuum tubing that goes through the chair. But we do make two different HVEs, and the new one is really lightweight and nice. If you haven't tried it, it's something that's available. So now it's called Easy Flex tubing.
All right. What about the A-dec 500 chairs? Do those offer a narrow back?
Okay, it's another really good question. We have one narrow back chair. We only make 3 dental chairs at this point, which is our 311, 411, and 511 chairs. You have the 500 chairs. They do have a slightly wider back to support a patient who's maybe a larger patient, or they're seated like this with their arms out. And we want the patient to be able to sit comfortably without contacting the operator. So we have that wider back right there, sort of at the 9 o'clock and 3 o'clock position. And that's something where I talk to folks who say, I kind of want a narrow back, but when I swing down to the 9 o'clock operating position, the patient's sort of on me. So a lot of times narrow back chairs, people feel like they've got to work at 12 o'clock, which you can do with the 511. But if you swing around to the side, you can really get underneath that chair. And that was actually the chair back in the slide I used. So we do offer a narrow back chair in the 311, but on a 511, if you have to swing around to that 9 o'clock or 3 o'clock space, I would try to get underneath it, raising the chair, maybe dropping it down and getting your legs underneath it so that you can get to that oral cavity, but you're not necessarily contacting the patient. And that's the design element there. So sort of answered your question and then posed another example.
Would you recommend a specific delivery system while thinking about both the ergonomic and efficient use of the overall space?
That's a fantastic question. Rear delivery, in my opinion, has 2 potential pitfalls. One, it's behind you. As we mentioned, you have to grab it and pick up something with your non-dominant hand and pass it to your dominant hand, then manage tubing to the oral cavity from something that's coming behind you. It also takes up a lot more space at 12 o'clock. So if you have a space-challenged operatory, I typically would advocate, if we have utilities that we can get to that delivery system, to put that delivery system on the dental chair, whether it's a traditional or a Continental. I've already said I love the Continental. It's sort of my favorite thing. But a chair-mounted delivery system allows you to pass it over here and frees up some of that working space at 12 o'clock. So in my opinion, just as the A-dec rep, seeing what I've seen and knowing what I know about space planning, I prefer the ergonomics of over the patient if we can get the utilities there. That's the big caveat of that situation. But that's when you have a good equipment and technology specialist, you've got your A-dec representative, you've got all of these people that can come and sort of work with you on that process.
All right, question for you, Joy.
Yeah.
Do you know of any brand of
Yeah.
loops that can accommodate presbyopia or multifocal vision?
I want to say designs for vision. I may be able to. I would also look into Surgitel and Q Optics. I would try those 3. But I want to piggyback off of what Daniel was talking about in terms of the preferred delivery system. So when you think about, we talked about musculoskeletal disorders and the considerations, think about what you're doing. It may seem second nature to you to consistently turn around, but if you're doing that 10, 12 times a day, 5 days a week, every month, 12 months out of the year, eventually that's going to take a toll on your body. But in addition to that, there are procedures, especially in the hygiene room. And what we're teaching now is that you need to be able to go beyond 12 o'clock. And in fact, there are certain procedures where you have neutral posture, it facilitates direct vision, where you can go up to 3 or even 5 o'clock. And so if that's the case, you certainly don't want to have a rear delivery system. In school, I was never, you wouldn't dare go past 12 o'clock, but now we're finding, I would teach my students, you can actually go up to 1 o'clock. To me, that's standard. More advanced seating, more advanced positioning has the right-handed clinician going to 3 to 5 o'clock. So just imagine treating on the opposite side of the patient. And so if you're going to be doing that, because those are some of those positions or seating positions promote ergonomic health, you have to make sure that you have a delivery system that helps to facilitate that.
All right, and then a quick follow-up to the loops. Is there a loop company that you recommend with the 90-degree telescope?
There are two designs for vision. I have worn their loops, great customer service, and I believe Andal, they are kind of the new kids on the block. I believe that all of the dental loop manufacturers will transition to that type of loop system eventually.
Excellent, thank you. Back to you, Daniel. Does A-dec make a saddle stool?
So I saw that question come in, and I'm glad I get to answer it because Dr. Joy and I, we talked about this a little bit when we were doing our presentation. A-dec does not make a saddle stool, and she talked about some of the benefits of saddle stools. What we have done, though, is on our new 521 stool, it's got a pommel. So you've got a clear front, even for the assistant stool. You've got a pommel where you get some of that same saddle stool feel, where you can come up and really use your own core and use your torso to support yourself and get into that neutral, balanced posture. But I saw some prototypes. I saw some of the things we were looking at. We still kept the backrest on that stool. And the pommel and the saddle portion is slight. It's not a complete saddle, and where it's got a much more sort of acute curve to it. It does have a backrest. So as you go through the day and start to round out and your head comes forward and you get tired, it's after lunch, you can then take a third paddle that we added and push that backrest forward and really use that as a crutch or a safety net. So we feel like we've designed something that kind of has the best of both worlds. If you haven't seen the A-dec 521 stool, it's very, very comfortable. It's nice. I think it's a good blend of saddle and traditional stools. So that's where we have arrived from an engineering and manufacturing standpoint.
And the saddle stool was not for everyone. There are ergonomics that was supposed to be to consider. So you have poor ergonomically designed saddle stools. So the thing is that you want an ergonomically designed stool, whether it's saddle or not.
Our office is brand new, designed with A-dec equipment, and we're noticing that the handpiece tubing is feeling sticky after the 2 months of cleaning with 3-minute kill wipes. Is this normal, or should we be using another product to clean?
So it's a really good question, and we spend a lot of time now. I spend a lot of time talking about disinfectants because, unfortunately, in the world we live in and the way that we turn dental treatment rooms over, the disinfectants have gotten much more aggressive because they have to be. And we want to be as efficient as possible. We want to wipe everything down. We want to protect ourselves, protect our patients. But my job is to come in a little bit and try to give you some tips and tricks from making that not only more functional, but making sure that we stretch the timeline of that equipment, because it's the disinfectants that will kill it eventually, not the patients and not the practitioners. So what I always recommend is we have silicone tubings that will stay pliable and stay a lot more ergonomic for longer, but they do tend to get a little tacky if we repeatedly wipe them. If you come back with some mild soap and water, just a mix of a little bit of soap and some water so that it doesn't get too foamy, and get those residues off of there, they'll go back to being a little slicker and they won't stick together as much. So whether it's silicone or vinyl tubing, soap and water will help that tremendously as you're wiping those down with disinfectants, because there's just so much alcohol and chemicals in those disinfectants. They can kind of start to get a little bit of a chemical bond, if you will, as they hang next to each other. But if you regularly implement some soap and water, it should straighten them out a little bit.
For hygiene or hygienists, where does the HVE come from? Is that behind or in front of the patient?
Dr. Joy, do you want to give your recommendation on this one?
I would say it depends on what type of HVE device you are using, because there's several on the market. I would just say it just really depends on what you're using, which type of attachment you're using, whether or not it has to come from in front of the patient, and do you know how to use it? How are you going to feel more comfortable using it? Okay. And if you, let's just say you don't have A-dec operatory, then you have to get into situations like where is the tubing? So, and then to me, it also boils down to preference. Typically, you come from around the back of the patient. That may not be possible, depending on what your operatory design is. So there are a couple of different factors that play into that. I can't just say front or back. I don't know, Daniel, if you have something to add to that.
No, that's perfect. A lot of it, or it can be out of our control, because if you don't have vacuum at the utility point of your chair, then it's probably going to have to come behind you. The only thing I would recommend is just try to get it within an arm's reach. If it's coming from behind you and you can pull it sort of as close as you can off of your left hip, that would be for me as a right-hander. Or if it's chair mounted, really kind of pulling it around, because you do want to surround yourself. I always think of the treatment space as a cockpit. Whether you're flying that plane solo or whether you've got a co-pilot, everything should be right there. I want everything to be somewhere where I can easily reach out and touch it and do what I've got to do, and then get it out of the way and get the patient out. So no matter whether it's mounted behind you or mounted on the chair, hopefully it has some reach and some flexibility to get right there where you can grab it easily.
And then, you don't want tubes lying across your patient chest. That becomes an infection control issue. So just wanted to throw that out there.
All right. And I think we just have one more question here. Talking about the A-dec rear delivery chairs. They're not good for ergonomics for right-handed dentists. What do you recommend to overcome the challenges of reaching behind and under or behind the patient's head to grab the handpieces and instruments?
The biggest challenge there, and I don't know which delivery system you have. We have many iterations that have come, and rear delivery is still a very, very popular place to put our utilities and our instrumentation. As I mentioned earlier, and I think sort of what you're referring to is, as you grab it and pass, then how do I manage that tubing? How am I getting to that patient without really draping that tubing over top of them? Some tooth surfaces can be easier than others. Some burr angles can be really tough when you've got tubing that wants to go back from behind you. One thing I would say is hopefully you have one that's a little bit height adjustable to get it where it's at the right height for you. Maybe pull it towards you. If you're having some challenges with it, it doesn't matter what vintage it is. It doesn't matter if it's 1-year-old, 5-year-old, 10-year-old. I love when people reach out to me as the A-dec representative and tell them something exactly like that. I really want people to say, hey, I'm having some challenges with this. Can you come in and work with us? Because that's my favorite thing to do, is to come in and talk to an office about ergonomics and really hopefully fix some of those pressure points or pain points that they're experiencing. So I don't know where Dr. Hurt is in the world, but if it's in North Carolina, feel free to reach out and call me. You can find me on the A-dec website, and I can come work with you, and we see if we can't fix that up. But I'm sure your A-dec representative would be happy to come work with you on something like that.
Excellent. Well, thank you everyone for the questions. I'm glad we filled the 15 minutes. And of course, thank you to both Joy and Daniel for being with us tonight and sharing such excellent and important information. A lot of requests for the recording and presentation. We are not going to hand out the presentation, but we did record and we will shoot that out to everyone in the next week. So check your email for that. And then lastly, if there are any questions, feel free to email us at webinars@henryschein.com. Or if you want to find our upcoming webinars, henryscheindental.com/webinars for our schedule. Thank you again to our speakers and for all of you for attending. Have a great night.
Thanks, everybody.
Thank you.